Hi, Miss Juanetta. My name is Chris. I'm a home health nurse. I'm here to check up on you and see how you're doing. I heard that you had some unusual symptoms. Can you tell me what's going on?
Well, it's all started when
I was gardening about a month ago and I got a terrible stomach ache and diarrhea. I thought maybe I had had too much prune juice that morning. Last week, while I was walking my dog, I noticed numbness and tingling in my feet, but I thought maybe that was because it was so cold outside. However, I decided to call the doctor yesterday because I started getting weak in my legs.
Do you mind if I do a quick assessment of you?
No, that's fine.
Okay. I'm going to check your deep tendon reflexes, okay? Uh-oh. It seems like you have areflexia, which is a diminished or absent deep tendon reflex. It also seems like you have some edema and inflammation in your leg. Do you mind if I do a more thorough assessment before I call your doctor?
Yes, please do.
Okay. Hi, doctor. I wanted to talk to you about your patient, Miss Juanetta.
Looking at the patient's chart, she has progressive weakness of 2 or more limbs, starting from the toes and up it goes. History of a recent Campylobacter jejuni infection, lumbar puncture, CSF with elevated protein and normal cell count, and electromyography that shows slowed nerve conduction velocity. I think this patient has Guillain-Barré Syndrome.
Oh no, not Guillain-Barré Syndrome. Wait, what is Guillain-Barré Syndrome?
A disorder of the peripheral nervous system is an acute inflammatory demyelinating polyneuropathy, often occurring after an infection and leads to rapidly progressive flaccid paralysis.
Most people recover from GBS. Because Ms. Juanita is over 60 years old, she's more likely to suffer complications. I'm going to order her intravenous immunoglobulin therapy to shorten her recovery by 50%. We also want to prevent her complications, such as requiring ventilation.
Okay, I'll make sure to perform frequent respiratory assessments and measure her vital capacity.
Right.
Hi, Miss Juanetta. How are you feeling now that you've recovered from GPS?
Well, thanks to those excellent nurses and doctors.
I can water my plants, walk the dog, use the pooper scooper, and get back to my simple exercise routine without all that nerve pain. I'm back to my baseline functioning.